Welcome back to Radio Rothbard. This is Ryan McMaken. I'm a senior editor with the Mises Institute, and we're here to talk today about the reactions of 3 different state governments to COVID-19. One of the remarkable things about the whole COVID shutdown phenomenon is that it has highlighted that it is really state governments that historically and legally have tended to have the lion's share of so-called emergency powers. So what we ended up with was a pretty big variety of different policies that different states used to implement their COVID quote-unquote shutdowns, if they implemented them at all. Some states never did, most notably Iowa and South Dakota, among a handful of others. Some states implemented harsh and long lockdowns like California, New York, New Jersey, and others, most of them being states with Democratic governors, although there were exceptions to this like Ohio. What's interesting, however, is that there's no clear correlation at all between the severity of lockdown and the total number of deaths attributed to COVID-19. For example, take Georgia. This was one of the first states to abandon lockdowns. This was done in early summer last year. Georgia was labeled by the corporate media as an experiment in human sacrifice because of this. And that didn't actually happen, of course. Georgia now has about 1,500 deaths per million attributed to COVID-19. Compare this to New York with 2,300 or New Jersey with 2,500. Now, similarly in Florida, which abandoned lockdowns last summer also and never went back, their deaths per million stand at 1,300 according to the official numbers. And compared to harsh lockdown California, which has a similar deaths per million of 1,200. So we've got very different policies, but similar results. So let's look at some other states in a little bit more detail. And here with me today to talk about this is Tho Bishop, an associate editor with the Mises Institute. And he's here to talk about his home state of Florida. And we've also got Zachary Yost, a frequent contributor to Mises.org. And he's written a few columns on the legal situation around COVID-19 in Pennsylvania. And he's here to talk to us today about Pennsylvania. And he's from Western Pennsylvania himself. So, Tho, let's start with you. Let's talk a little bit about Florida. Hey, give us kind of just the basics of what things look like there in terms of their lockdown strategy.
Well, currently right now, again, particularly in the Panhandle, where there is a lot of difference. I've traveled throughout the state a little bit over the last several months. There is difference in terms of like how much you see masks, how serious some of the businesses are about enforcing it. But up in the Panhandle, most of the places that I occupy, you hardly even see a mask in the room. Restaurants have been at full capacity for a very long time now. Schools are open. So my day-to-day life in Panama City Beach, Bay County, has very little different now than it was in 2019. And again, traveling around to different states now, I was in Missouri this past weekend. It's even though it was a lot more open than some of the other states out there. Even there, you had a lot more masks and sort of local restrictions than you do again for any day-to-day life in the state of Florida right now.
So I assume there was an initial, like the whole country panicked, right? Like in March.
Right.
And so when was this initial, was there a full-blown stay-at-home order that was put into place at some point?
DeSantis put it off. It was April 1st was when they put in the stay-at-home order. You still had the ability to go to the store and things like that. Walmart was still open, but that lasted for that month. They shut down the beaches, which was one of the really stupid things. They actually opened up the beaches prior to the end of the stay-at-home order. I think the beaches opened up on April 17th. So that's kind of interesting. That just shows how serious, how severe the stay-at-home order was. But really, it was that 1 month, and then they went into kind of a phased reopening plan where restaurants were allowed to open up at 25% capacity. Bars were always treated a little bit differently. I have some friends that are bar owners. Even there, though, for example, in Bay County, you had all these loopholes that kind of emerged where a bar was set up like a hot dog stand, would be able to rely on that license to open up, even though bars were technically shut down. The one bar in Bay County, they just offered chips with every drink, and they were able to open. So there was plenty of loopholes that were kind of found in there. But the phased reopening started up at the end of April, and then I think it was a couple more months after that, and you kind of had full-on 100% opening with some encouragement of social distancing. And then one of the biggest difference, though, between DeSantis and most of the other states out there and this is kind of interesting from a political decentralization aspect, is that at the state level, he prevented the ability of local governments from enforcing fines or any sort of tools of the state in enforcing their own lockdowns or their own mask mandates and things like that. And so even some of these big cities, in like Tampa, for example, after the Super Bowl, right, people were freaking out. The Tampa mayor came out and said, "Oh, if you were without a mask at the Super Bowl, our police are going to come after you." They can't though, because like DeSantis took out, they declawed all the enforcement mechanisms at a local level, and that is really what has created that culture where, like, again, you can go throughout the state and like no local government can kind of come in and try to give you a nasty fine if you don't wear a mask at the right place.
Well, things I think were a little bit different in Pennsylvania. Zachary, maybe you can give us the basic rundown and timeline there, just to, I think, highlight some of these differences.
Sure, and thanks so much for having me on. Pennsylvania was one of the first states to kind of start to enact lockdowns and things like that. And I think that had to do with on the eastern end of the state's proximity to New York City, which was, everyone freaking out about that last March. It was like the epicenter of everything going bad. So it kind of just cascaded from you should not go out, to stay-at-home orders. Business, all quote-unquote non-essential businesses were shut down. Things were like that for a few months, and then there was a phased reopening where like no restaurants were open, you couldn't get your hair cut, stuff like that. But then they started phasing in, and county by county, basically, and a lot of there's basically rebellion across the state where county officials were like, this is nonsense. Why are we in this category and this county's in that category? And it's like, we're just moving ahead anyway. And local district attorneys were just like, yeah, I'm not going to prosecute anyone who, doesn't follow directive XYZ. So it kind of declawed the state's government's authority to enforce the strictest lockdowns they had. So those were lifted towards the beginning of summer. Although it's important to note that we were one of the first states to have a mask mandate, and we still do. And mask wearing has been basically universal since kind of last April, I'd say. And technically, according to the state rules, you're even supposed to wear a mask in your own house if anyone from outside your household is there. But that's kind of not followed at all, of course. But I think it's important to note that there's kind of a divide between the de jure rules in Pennsylvania and the de facto rules, because under how the law currently is, all of these restrictions, stay-at-home orders, all that kind of stuff is technically still in effect, but they're not in effect at all really in practice, the harshest ones. We have mask mandates, restaurants are limited capacity. You have to have food to order alcohol, things like that. But in terms of not being able to leave your house or, certain, there's no non-essential and essential business classifications anymore. But on the ground, it's been my impression, at least where I am outside of Pittsburgh, I have never witnessed anyone berating anyone for not wearing their mask properly or anything like that. I think my impression from the beginning is that people have generally been pretty stoic about it. It's just people don't want to create a scene out in the grocery store. But I have not witnessed many people, fanatically enforcing mask restrictions. Sometimes if you're in a restaurant, they'll ask you to wear it when you're, walking to your table or something like that. But I've not witnessed any fanatical support for all these restrictions. So I do have some hope that public opinion won't be something that holds us back from reducing restrictions even further.
Well, it seems that Pennsylvania is one of those states where there is some real resistance, both institutionally and out in the public, because you wrote recently, for example, on how the district attorneys weren't prosecuting, and then more recently wrote on this effort to amend the Constitution and so on. So is there something of a sense of the governor is trying to implement harsher measures, but the public's not going for it? What's kind of the flavor of that?
Yeah, I think that my impression is that the administration would be doing things a lot harsher if they thought they could get away with it. The legislature is controlled by Republicans in both houses, and it's, with a few years of exceptions, has been dominated by the Republicans for almost 30 years, whereas the governor kind of switches back and forth frequently. So the legislature has been pushing back a lot because the governor's office has been kind of ruling Pennsylvania by declaration. So there is an effort to amend the Constitution to kind of restructure how emergency declarations work. It's kind of absurd. We can have been a state of emergency for years, and we've been in a state of emergency for years over the opioid crisis. It makes it very easy for the legislature to end a state of emergency and very difficult for the governor to continue it. But unfortunately, the governor claims he derives all his legal authority to literally for everything he's done, from the stay-at-home orders and shutting businesses down and capacity restrictions and everything, from a Disease Prevention and Control Act. And so I'm a little pessimistic that even if this constitutional amendment is passed via referendum in May, that the state Supreme Court will still uphold everything the governor has done, because that's what they've done to date so far. It's an elected position, and it's controlled by Democrats, which our governor's a Democrat. So I'm not exactly optimistic that changing the emergency declaration rules will end everything, but I am optimistic that it might further the momentum towards let's open up more and kind of get rid of the remaining restrictions, especially the masks. I think a lot of people hate wearing masks, but there's not much active resistance. And I think it's generally because everyone recognizes, like, the Walmart greeter and, the waitress at the restaurant, they really don't have any control over the situation. They have to ask you to wear a mask. So I think it's kind of followed out of respect for them. But I think that there is a general, like, let's get this over with attitude.
Yeah, we have nothing so dynamic in Colorado, at least not at the statewide level. Most of the resistance, I think, is regional. But I should note I live near the city center, so in the middle of Metro Denver. And I think there's a lot of voluntary compliance there. I think if you go out to some of the suburbs that are more Republican, then you will see, I think, less mask wearing and more people really kind of just pushing the envelope on that. But even that being said, like you, Zach, I've never witnessed anyone yelling at anybody else about wearing a mask. I did see one place where at Halloween I was in a party shop buying masks and stuff, and the cashier took one of those disposable masks to a person who wasn't wearing one and asked her to put it on, which I think she did. But it was all, of course, in the spirit of of customer service, I suppose. And so that was the most I ever saw. And this, again, was near the epicenter of compliance. Perhaps the only more compliant area would be Boulder, Colorado. And I haven't been there in a long, long time, so I'm not sure what things look like there. But I went out skiing, cross-country skiing, and I actively chose to not go to Boulder County as I have in the past, just because I didn't want to deal with it in Boulder County. And I think that's a thing all its own. But if you go out to the suburbs or Weld County, which interestingly had early on actively resisted the governor on his stay-at-home order, things are probably more chill up there. And I should note that the timeline on this was similar to everywhere else. March 25th was the stay-at-home order was put in place, and that lasted about 1 month to late April. And shortly before that, I had participated in one of those, end the lockdown protests, I suppose you call it. And of course, tons of people were out for that, some wearing masks, some not, and so on. And that was called a slap in the face of medical professionals and all of that. And this made international headlines because some alleged nurses went out and blocked traffic because it was a two different mode of protest. There was also just people driving around all the time. Then there were some people gathered on the Capitol lawn. But these supposed nurses, who some people said were actually strippers, I don't, who bought some scrubs. I don't know if that was true. But they were out there blocking traffic because only a madman would be outside. Of course, a few months later, medical personnel completely changed their position and said, no, protesting's great as long as you do it for stuff we agree with. And but that was kind of the feeling there. Come late April, everybody was basically over it. And then they went back to this safer at home thing where you were not expected to stay home, but they really turned the screw still on private businesses where everybody had to wear masks at the private businesses. And of course the cops weren't harassing ordinary people for not wearing them, walking down the street and stuff. It was the whole will harass businesses for not making people wear masks. And that was kind of that was the way I think they figured out they could make people do things was, we'll make the businesses make people do things. And if the businesses don't make people do things, then we'll shut the businesses down. And that was the strategy. And so that was tried. And then by summer, of course, people weren't really paying attention. But unlike Florida, the state did come back and close things down a little bit more, reducing restaurants down to a 25% seating capacity. And that, of course, hurt the businesses. Now it's back to a 50%, which in most places just kind of feels normal. And of course, if you're eating and sitting somewhere, you take your mask off, so it just feels like a normal restaurant, basically, once that happens. And if you go into a place like I did the other day and there's cops eating in there and they don't seem to care what anybody's doing, then you know you're probably fine. But so now it's at the point where, okay, I don't think anybody's going to go for any sort of stay-at-home order again. And the governor basically said this explicitly a couple of months ago, where he and the mayor of Denver were concerned if they attempt an actual full-blown stay-at-home order, nobody's going to actually follow it. So that those days are probably over unless there were to be something that would really get the public freaked out to the point that they would go for it. But that's hard to see, especially in Colorado, which has very low total deaths at this point. I think down around 1,000 per million population. Yes, about 1,000. So considerably less than really most states, really in the bottom third or bottom quarter, and so on. And who knows what that is, right? We've looked at reasons why do these states have very, very different policies and very different total number of deaths. Pretty hard to pin any sort of correlation there at all. And Colorado's just another example of that. It might be noted that maybe Colorado's a younger and fitter state. Of course, the two main contributors to COVID deaths we know are obesity and old age. And Colorado is the thinnest state, with maybe the exception of Hawaii, and fairly young as well. But on the other side of it, right, you got Florida, which has one of the highest median ages, and they're certainly nowhere near the sorts of deaths we're seeing up in the northeastern part of the country. So it seems that we've gotten past the initial freak out. The stay-at-home orders are gone unless you're in some sort of really over-the-top state of California where Newsom could bring that back at any time. But the political situation here is pretty sedate. The legislature controls or is controlled by Democrats. So even though it is actually easy for the legislature to end emergency powers of the governor, they're not going to do it. All you need really is a resolution out of the legislature that the governor does not need to sign. And that's just not going to happen because they're all in the same party. And the Supreme Court has tended to side with the governor also because from time immemorial, the Supreme Court has been dominated by Democrats because the governor's mansion has had Democrats in it in basically every single year except for an 8-year period from 1998 to 2006 since back in the 1960s. So things were different for a while where you had a long period of Republican-controlled legislature with Democratic governor. That was kind of the norm for decades in the second half of the 20th century. But slowly over time, the legislature became more Democratic. So now you've got basically kind of you've got a Democrat trifecta in Colorado now, which means that nobody's really doing anything. Some citizens tried a recall effort. That failed miserably, partly because I think Polis has been smart enough to not be bonkers like Newsom in terms of lecturing people publicly and going out to posh parties with his rich friends and then getting caught doing it and threatening all sorts of other lockdown measures and so on. And so it's even the people who don't like him, there's not a whole lot they can do because he's tried to at least appear like something of a moderate on this issue. And so if you had to predict what's the future going to hold, right? It sounds like things are de facto already back to normal. When does it reach the point where you just kind of abandon the whole thing, even in a de jure sense?
Okay, I think it's more or less there now. The one thing that and I think it goes to the fact that Florida's mortality rate, even amongst the elderly, is significantly lower than the national average. I think our mortality rate with those over 65 is 474 per 100,000. The national average is a very telling 666. New York was all the way up, is over 1,000. As the vaccine rolls out, ignoring the questions on the specifics of the vaccine issue, they prioritize the seniors on that, and that's still that's the one demographic where there is some restrictions, particularly in nursing homes and things like that, where they've been very secure on. And so I think as the vaccine rolls out, goes there, I think people will be able to visit. I've got a great aunt in Miami that I haven't seen in well over a year, and that's been difficult for my family. I think that's kind of the last little bit is trying to get the vaccine numbers in a way that the state still looks as a strong measure there. But one of the interesting things is politically the fallout, because in 2020, not only did Trump do better than he had in 2016 on kind of a partisan referendum, but the Republicans actually also gained seats in the state legislature based on this. And last year, a lot of Democrats are putting in a lot of national attention on the agricultural commissioner, Nikki Fried, as a potential person to take down DeSantis. I think largely going forward, DeSantis's leadership now is being seen. He's now being considered a front runner for 2024 because of his handling on being very aggressive on this issue. So I think it's something that, again, hopefully other Republicans will see this and just, if only their own cynical self-interest, will see the DeSantis model of doing things. Particularly with, again, putting aside the question of whether it's good to have kids in government schools, the school issue is one of those ones that's really kind of becoming a major national political point. And so I'm hoping that other Republicans around the country will see what DeSantis has done and will mirror that, because politically it's paying off. The results are paying off. And economically, Florida's economy is doing very well relative to most of the rest of the country. So Florida is one of the best places to be in the world right now.
So, Zach, what do you think it'll look like in Pennsylvania come summer when it warms up again? Those of us who live in states that have 4 seasons and such, where it's going to be cold here for another 6 weeks or so, but then it gets warm and people just hang out outside and they're not paying attention and they don't care. I mean, can Wolf's emergency situation survive another summer? What's that going to look like?
I am a little optimistic that it won't survive the summer. For one thing, vaccines are kind of humming along. There's been a little bit of a hiccup in Western Pennsylvania. That's not surprising due to the kind of Soviet-style distribution of vaccines. But between vaccinations and what I expect will be another significant drop in cases and deaths once the weather warms up, I kind of am hoping that the summer will put the remaining restrictions to rest. Even now, where it's kind of like looking back at the state's dashboard of cases and deaths, there's a very large spike over the past few months, which has basically happened everywhere. But if I want to go out to eat, there's usually a wait at restaurants, or they're very close to their half capacity limit. It's one thing I've talked to several people about is that I've noticed that it seems that because there's not, regular, I guess people are still a little hesitant to do regular kind of recreational things. At least some people are. it seems everyone has taken to like grocery shopping as their means of entertainment, because it does not matter when I go to the grocery store, what day of the week, what time, it's always very crowded. So people are out and about a lot, even if they're not necessarily crowding into bars. But I went to a bar for the first time just a week or so ago, since in months, and it was very full. So I don't think that once the weather warms up, people will be really restricting themselves at all. So I am hopeful that the mask mandate might go away and the restaurant capacity limits will go away sooner rather than later, but I can't say when that would be, I suppose.
Yeah, I don't even encounter that much resistance where I hang out. Where, of course, I go out almost never, so I don't have very good perspective on what people are doing for fun, normal people. So I don't know if bars have a lot of people in them. I mostly go to breakfast with people early in the morning, so there's nobody there anyway. But I do know from going outside to places. So, boy, talk about back when people were bonkers. There was a time back in March and April where the federal government and local counties were closing down hiking trails and trailheads and open spaces and so on. And this is just over the top insane. This is like our version of closing the beaches, right? You don't close the hiking trails. This is what people do. And that was all going down because you might walk within 10 feet of somebody on a mountainside where you're going to catch their COVID and so on, was what people were thinking. And that's past tense now, right? And for me, the normal situation I encounter is when I go to mass on Sunday, where people, at least the one I go to, nobody's paying any attention at all. So yeah, there's some masks like here and there for politeness sake, and then they come off as soon as people sit down and that sort of thing. And it's just then people socialize afterward, and then there's just, you would think there wasn't really anything going on, except maybe there were some people who were concerned because they were immunocompromised or something like that, like you might have encountered in other years, normal years. And so there's clearly some resistance there, though. But I don't think those people are reflective of the overall population. So I don't know, maybe I need to go out to maybe Western Colorado or so on to take a better gauge of what people are thinking. But your comment, Zachary, reminded me of a recent article in the Daily Mail where they were talking about how, just as I mentioned, California and Florida have very different policies, but pretty much the same in terms of outcome. And they were exploring this a little bit in the article, but then they quoted some guy, some doctor, some medical school professor who apparently had no expertise in psychology or mass psychology, that sort of thing, how people think in groups or anything like that. But he was waxing philosophical about why California and Florida were the same. And he was saying, well, since different states are doing different things and there's no coherent message, people hear that there's different message coming from different places, and that makes everybody be more cautious. So everybody's being extra cautious everywhere, and that's how we're keeping numbers down. But that seems to be complete nonsense from what I've seen. If you've traveled around the country at all, you can see there are some parts of the country, Georgia, Alabama, Florida, and apparently in a lot of bars and restaurants in Pennsylvania, where nobody's paying attention, nobody's interpreting, oh, well, gee, some people in California are saying one thing and some people in Tennessee are saying something else, so I guess I'll just opt to be on the safe side, I'll mask up and stay at home. That's not the response I'm seeing at all.
Yeah, I mean, my experience has been the exact opposite, that so much conflicting information has undermined the credibility of all the various orders.
Yeah, what do you think of that, Tho?
It definitely saw that in Missouri, where again, like there was a lot of mask requirements, particularly with men. Like the compliance rate with men was probably less than 50%, which I was very happy to see. There is that lack of confidence, particularly with, I think, the national information, and I mean Dr. Fauci in particular, right? I mean he's all sorts of great documentation on his conflicting views on proper handling of COVID. He was very anti DeSantis for a long while. And one of the things that I think has benefited Florida in particular is that because of all the conflict at the national level, DeSantis put together like his own team of public health experts to kind of give them a intellectual defense of the policies and the reopening, the aggressive reopening that DeSantis was going for, rather than simply relying upon like CDC guidelines. And so again, I think that's another way where bringing in that sort of team helped DeSantis on the policy side of things. in particular on the reining in on the local restrictions. He was able to point to the science and the data to make his arguments that I think helped make that sort of compelling case necessary.
Okay, so predictions, elections, statewide elections, 2022. What are they going to look like there, Zach? Anything interesting happen?
Well, something very interesting happened. At least on the state, there's kind of an open-ended seat right now. Our senator, whose name is escaping me right now, I was just talking to Tho about him, is not running, and he voted to impeach Trump. So the state Republican Party is planning to censure him, as best I understand it. And I think that race could serve as a referendum on the state lockdown situations, maybe, because the lieutenant governor, John Fetterman, who's kind of like a Bernie Sanders kind of Democrat, has announced he's running for the seat. And he's strongly associated with the lockdowns and everything. So if the Republicans manage to run someone who's not completely terrible, I think they might be able to capitalize on the pro-Trump sentiment in the state and on the unhappiness with the lockdown situations. I have no idea what to expect in terms of the governor's race. Wolf can't run again, so we'll have a new governor no matter what. And it'll be interesting to see if it's someone closely associated with him, if that will also serve as a referendum on how he handled the lockdowns.
So in Florida, though, you sound pretty white-pilled. So will there be any Democrat with any seat left anywhere in Florida come 2022?
Hopefully not. I mean, hopefully those kind of find another state to go to New York. Well, the big challenger, or perceived as the big challenger, is our agricultural commissioner, Nikki Fried, which is interesting because one of the big things that the agricultural commission actually does is handle our gun rights, and so that's kind of caught some issues. But the funny thing is that you look at like her, not that Twitter is a great measure of everything, but like, she's being touted. It's like, oh, well, she's the only statewide elected Democrat in Florida that we've had in like, a while, at least outside of the Senate seats. And like, she still only has like 40,000 Twitter followers. By comparison, there's an account called Cat Turd that has 400,000 people. So perhaps there's a good measure that Twitter is not as awful a site as sometimes I think it is. So I don't think that she's going to be a major challenger at all. You might have, there's a state rep who's kind of like a Bernie sort of person who could end up giving her a strong primary challenge just because of some of the internal Democratic politics there. But, Florida now has become the center of the Republican Party, with DeSantis. I mean, you could have 3 or 4 presidential candidates in 2024 coming from Florida right now. The great thing, though, is that, it really is not simply Florida leading on this sort of policy. And they've been doing all sorts of it. We have at least amount of spending per state out there. We're doing some really interesting things, liberalizing healthcare. So it's not just simply great reaction to COVID. I think in a lot of ways, Florida is showing what, good conservative, however you want to phrase that policy looks like at the state level. And hopefully that will translate into highlighting that economic liberalization, has advantages in a practical sense, and perhaps can guide other states to join it. So, again, as a Floridian, if you're out there and you're miserable because of your government, then hey, come down to Florida. And I know some good places in Panama City Beach that you can get some good food and a few adult beverages.
Well, the comments that we've made here, right, have made me aware that a lot of it's beyond just what your government is up to, right? Like Zachary is saying, you could read in the paper what the government is doing in Pennsylvania, but the reality of the people is considerably different. And Florida, there seems to be something of a matchup between the two. In terms of DeSantis doesn't seem interested in lockdowns, and neither does most of the population. But there are definitely places out there where, you can see what the official acts are. That's just not reflecting the reality. Also, you could be in a place, right, where the state is pretty laissez-faire about it, but if all the neighbors around you in your little community are wearing masks in their living rooms and stuff, I mean, that's pretty depressing. And you do encounter some people like that around here, but they're considered a little bit over the top, to say the least. And so, yeah, you just you want to live near where people you agree with, right? I'm astounded that my relatives all still live in California, but apparently this is a thing. So, still living in California when you have the means to leave is apparently something people do. So that I do not particularly understand. As far as 2022 goes here in Colorado, I don't expect big changes. I think most of the Democrats, members of the legislature are pretty over the top in many cases, but I think the governor who's got to run, and then Bennett, I think from the U.S. Senate has to run. I think these people are smart enough to at least give the impression that they're moderates and don't have any plans to take away your guns and things like that. But we shall see. I mean, basically, after the experience of 2020, I'll believe any horrific thing could happen. And I have no faith in the mob's opposition to it. But we shall see. So thank you, Zachary. Thank you, Tho, for joining me today. It was good to get a handle on what's going on in some of these places. And we should, once it's looks like maybe it's fading away, we should come back and maybe give a post-mortem of how everything went down, although I do not know at what point that is going to be the case, but we shall see. So thank you all for listening to Radio Rothbard, and we'll be back next time. And until then, have a wonderful week.